The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White, and we're very glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Chemthorne Motors, and, of course, our technical producer, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist, and our special guest, registered nurse and program director for the Mercy Wound and Hyperbaric Center, Kim Landsberger.
Good morning, Kim. Hope you're doing well today.
Good morning. Yes.
Wound care is essential to healthy living. Most of us have experienced scratches or scrapes and healed naturally, but sometimes there are wounds that just will not heal. Other issues, diabetes, circulation problems, radiation, and many more things can complicate that healing process and turn the simplest wounds into complex, non-healing health issues that can cause big problems. Thanks to science, we know that the wounds need oxygen to heal properly. And when the body isn't getting oxygen it needs, there are other steps that can be taken to impact the healing process. Today we're going to talk about these treatment options. I'd like to remind our listeners today that our broadcast is also available on our podcast that you can download from your app store on your smartphone. You can look for Health Matters with the Medicine Center Pharmacy and listen to any of our programs at any time. If you have questions during today's program, we invite you to post them up on our live Facebook feed or give us a call at 330-450-1480.
So, Kim, tell us a little bit about yourself and your role at Mercy Medical Center.
My name's Kimberly Landsberger, and I've been with Mercy Medical Center for almost a year now. We had our grand reopening last year in April, mid-April, and we brought back hyperbaric oxygen therapy to our center, and I'm their program director. I basically run the day-to-day activities there, help the staff out if need be, and make sure our patients get the top quality care they deserve.
Very interesting. Okay, I guess hyperbaric oxygen, I'm going to jump a little ahead here, has been around a long time.
Yes.
And Mercy was out of it for a while? Or?
They had it, I guess they got rid of it around 2010, but as time grew on and they saw the need for it to come back because they saw how much of a benefit it was to the patients, we brought it back, and we have these great, two nice, large, and in charge hyperbaric chambers that are completely full and taking care of patients every day.
You know, a friend of mine 30-some years ago or more went to Ravenna, I think, and they were using the old iron lungs.
Oh, yeah. We don't. Ours are nice and much prettier.
Okay. So what type of wounds do you encounter at Mercy's Wound and Hyperbaric Center?
We have a wide range that we see. The most common ones that we do are diabetic foot ulcers. We also deal with venous leg ulcers, arterial ulcers, compromised flaps and grafts. We've dealt with recently some frostbite cases. How
does it work in that?
Well, they can get the blistering with the oxygen getting cut off from the cold. Okay. So we can do comprehensive wound care with dressings, and then also we can look at hyperbarics as well with that.
I think of frostbite as frozen.
Yes. Well, you just cut off circulation from the cold. The cold just took all that circulation away. Okay. So that's how, and then all that area will die, and that's where it turns black. And that's when we look at hyperbarics and wound management as well.
Whether this is the time for that or not, I thought before that only the body part was moved into the hyperbaric oxygen chamber, but true fact is that the entire body.
Yes, it doesn't work without the whole body going in.
Okay. So are diabetics at an increased risk of wounds that won't heal? I mean, I know the feet, the peripheral circulation. And what types of wounds do I have? Am I on target here? Or
no, you're right. They are at an increased risk. Reason being is usually uncontrolled sugars. What happens is the white blood cells are so focused on trying to control the fluid and bring down the sugar content within the system, that it doesn't focus on the circulation of the legs, so in the whole body. So when you have that, there's pressure, not wearing the right shoes or something like that, and you cut off circulation to that area, causing more diabetics to have open ulcers, calluses, cracks, dry skin, when they don't keep those sugars under control.
So diabetics can do what to reduce the risk of obtaining heart disease?
The number one thing is look at their legs and their feet every single day. Wash their feet every day. Pat them dry. Inspect their feet. Look for those cracks and calluses. Once they get all that cleaned up, apply lotion, wear socks, and most importantly, wear shoes. Never go barefoot, whether it's in the yard and especially in your house. You never know when you're going to step on something.
Interesting.
What about difference between venous and arterial ulcers? What populations are greater at risk of these? And maybe you ought to give us a little bit of background on what a venous ulcer is and what an arterial ulcer is.
So venous ulcers occur because the blood flow problem is going out. There's not, the blood is just sitting there. This allows for swelling and pressure to push outward into the lower leg, causing ulcerations to occur. Arterial ulcers have a problem with not enough blood flow going into the extremity. So the pressure or the trauma that hit the outside of the leg exacerbates the wound that won't heal. Populations that have an increased risk for venous ulcers are those who struggle with morbid obesity, family history, a history of DVTs. And then for arterial ulcers, the greatest risk for occurring is family history, diabetes, but above all, smoking. It's most common reason why we can't get those arterial ulcers to heal.
So you mentioned post-radiation injuries that are treated at Mercy Wound and Hyperbaric Center. For those listeners who aren't familiar with radiation or the toll it takes on the body, well, why would radiation parents need your facility at the Wound Center?
So cancer patients go through a great deal of treatment and care with chemotherapy and possibly a combination of radiation. So when they go in for their radiation treatment, that radiation is given to that spot of that area, and it obliterates and tries to kill those cancer cells. It burns it off, yeah. But the problem with that is it also kills off the surrounding tissue. And when it does that, it kills all the healthy tissue around that area, causing scarring, complications of ulcerations, burning, and not allowing that to heal. It could heal, and then 20 years down the road, all of a sudden something happen, you have a traumatic event, you bump it, or you scratch that area and it comes open, but it just will not close. From there, after they try standard therapy and nothing is working, we try oxygen therapy because it helps push that oxygen and help blood flow, produce more little mini capillaries to that skin. So
my next question is do non-healing wounds usually result from one single cause?
No. There's a number of reasons why these wounds don't heal, whether it is nutrition, not proper offloading, sitting on it too long, laying down on it too long, their infection, if there's any kind of infection going on, any swelling, their blood flow is inadequate. There's usually a multiple of combinations that keep these wounds from healing.
So how do I know it's time to go to the wound center?
If you can't heal a wound on your own within probably about 2 weeks.
An open wound.
Say you bump it, you scratch it, or you just
not a bruise, not a
if it's open and draining, and you can't heal it on your own, I would say give us a call at least in 2 weeks. For diabetics, I say sooner than that. With them, I get them in because I've seen those turn literally in 24 hours.
So, I guess thinking about myself, when I scratch or whatever myself, it heals rather quickly. But what kind of a time frame are we looking at here if it doesn't heal? Your
average time you want to heal a wound for everybody else is around 30 days. If everything usually heals within a month for a standard person.
I think that's an awful long time, isn't it?
Well, you have that scab and everything like that, but if it falls off and there's nothing there, and that's it. So sometimes those scabs can last that long, but as we get older. But if it stays there and just will not go away, that means that wound is not healed. So we need to get them in there, and it takes it could be quickly when we find the underlying issue as to a pretty extensive time, but the faster we get to it, is the faster we can heal it.
So, what about, walk us through an evaluation and diagnostic testing.
So, your first initial visit at our center is pretty extensive, and it usually takes at least an hour. We have our nurses come in, they take your vital signs, and we ask you a bunch of questions. Your family history, your social history, your medical history.
So you're not going to plug me into that machine right away?
Not yet, no.
Okay.
Now, if I see it, though, those questions usually will decipher if you need hyperbaric oxygen therapy, and sometimes I kind of already have an idea when your physician sends you over just by your questions and what's going on with you. But we do a pretty comprehensive exam. We look at your lower extremities, if there's a wound on the lower leg, evaluate your pulses, your vascular assessment, and just take measurements. We take pretty pictures of the wounds, no posting on Facebook, and we
oh, why not?
No.
Well, what the heck?
No, that's between the patient and their account, not me.
All right. Well, that's interesting.
All right. Well, tell me, I can only imagine, I'm thinking of our pharmacy education and seminars and continuing education, and when you put someone like a diabetes person in the mix, or even if somebody had maybe a terrible car accident, I can only imagine the variety of wounds you've seen. What kind of, I assume that there's different treatment plans and approaches for each type of situation. Can you give us a garden variety example, maybe?
So we have a wide range of type of treatments. Besides the comprehensive wound management, we have the advanced dressings that science has come up with to help us grow new tissue and heal these wounds faster. We have compression therapy. We do serial debridements weekly. Taking out that dead tissue on a weekly basis helps heal those wounds faster. We help provide proper offloading. We also try to do infection management by taking cultures and treating the infection if need be. We also do the vascular assessments, and we'll have intervention if need be, referred out. And then hyperbaric oxygen therapy is another great treatment plan as well.
Lots of tools.
Yes.
Is this the sort of thing that's going on all the time? I mean, are your units 24/7 or?
We are open just Monday through Friday from 8 to 4:30, but our physicians also see patients on the floor. We also do an inpatient consults as well with our nursing staff and assist with dressings on the floor as well.
Okay, I think we're going to take a break here. Our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
That's right. This is Paul White, and the Half Off on Hot Buy store is your cold weather source. Women's Winter Tech gear boots are only $6.95. Fashion boots are marked down to $9.99. Retail value up to $60. And hats and gloves are on sale, too. New in the store are American greeting cards. 2 for 99 cents. Regular price at $4 each. Also, for snow shovels to floor mats, stop in the Half Off on Hot Buy store. Find the best deals in town.
Hi, this is JP, and I'm here with my grandpa talking about the amazing deals at the Half Off and Hot Buy store in Louisville. Visit our website at halfoffhotbuys.com and check us out on Facebook, too.
Hi, this is Brad White from the Medicine Center Pharmacy. Do you feel stressed and tired? Do you rely on caffeine, crave salty snacks, have mid-afternoon lows, and can't bounce back? These may be signs of adrenal fatigue. The Medicine Center Pharmacy offers easy saliva cortisol testing and nutritional supplements to help you get your energy back. Talk to your Medicine Center pharmacist and see if cortisol testing is right for you. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we are joined by registered nurse and program director of the Mercy Wound and Hyperbaric Center, Kim Landsberger. Have a question? Give us a call at 330-450-1480 or post your question on our live Facebook feed. So, if I had to have hyperbaric oxygen therapy, is a course different? I mean, okay, let's say I get foot ulcers or something like that, or compared to, I don't know, a broken arm, or, you know, it doesn't heal or something. Is there different times that you prescribe or that you would subscribe the patient to length of time?
Yeah, so each diagnosis that we treat in hyperbaric oxygen therapy may have a different length of time or even a different depth. The same, it's 5 days a week, 2 hours a day. That's the hardest part of anybody coming in and doing hyperbarics, but that consistent daily treatment of that oxygen gives that buildup and that keeps that flow going, and it forces that 100% pure oxygen into the tissue and helps fight the infection. So
you look at it visually. I mean, there can't be any real test to prove that it's any better, right? Or I guess
visually, I mean, if you look at the measurements of the wounds, that's how we visually look at it. We look at, how their infection is doing, if their wound is healing. If their wound isn't healing, then it's not working. But I haven't had one not work. Okay. As long as those patients are consistent coming in, and there's no other underlying issues going on. We've treated every underlying issue there. That should work. And
you don't cease other therapies, like let's say they were taking antibiotics and...
No, we put a whole comprehensive management intertwined with a hyperbaric oxygen therapy. So we make sure that they get their standard of care with their dressings and treat the infection with the antibiotic therapy. And if they stall out, we then, if they qualify, we will initiate hyperbarics.
Okay. Let's go ahead, Brad. I've mingled some questions.
Well, I'm thinking, I know I have a particular physician friend who had some hyperbaric oxygen therapy for a wound, and it was a rather stubborn wound. But he was describing me the treatment sessions. So I know we probably have listeners thinking, what do you do for 2 hours in a hyperbaric oxygen container? What can you do to help the patient pass that time and make them more comfortable?
So we got some flat screen TVs attached to the monitors up on top of the chambers. We have DVDs. We can put the radio on. We can turn the lights out. They can go to sleep, take a nap. I wish I could go take a nap in there every day.
But wouldn't the oxygen kind of stimulate you, the extra oxygen?
You know what? Most people take their naps.
No kidding.
Yeah, they get nice and calm in there. Once they're to depth, they just kind of calm down. Everything they go take a nap.
I remember my father describing, he was a metallurgist, and he managed the lab in the steel company. And I remember my father saying, well, gee, I went in there and got a whiff of oxygen from the... I don't know if it was pure or what. Oh, man, I'm awake. It energizes me now, so...
The oxygen does energize the cells and everything like that, and a lot of patients come out feeling great, and they're good for the day, and then some every now and again just say, oh, that tires me out, I'm going to go take another nap. And I'm like, I wish...
Well, the oxygen bar thing was big time a few years ago.
Yes.
I don't see that anymore anywhere, but
not around here. They still have them out west, but because of the altitudes. But yeah, oxygen bars really don't. At ambient pressure, it really doesn't do much. You really need the pressurization from the hyperbarics in order for it to actually help and heal wounds or late effects of radiation in that aspect.
Okay, interesting.
What about other benefit? Are there any other benefits found from these treatments with respect to, I mean, you're treating the wound, but any other ancillary things that you've discovered in your course of therapy or in experience?
The biggest thing, like, for example, I love doing late effects of radiation and hyperbarics. Reason being is that, like, for example, I've had quite a few patients recently come through with irradiation cystitis, where they have severe pain in the bladder area, swelling. They have a lot of bleeding and clots, passing of clots.
Even though they weren't radiated?
No, they were radiated in the past.
Okay.
I had there's a few.
But in that area?
In that area, from prostate cancer.
Okay.
Yes.
Okay.
And then years later, they come down with an infection and end up having all the bleeding and clots, and it's just not being healed by standard therapy. So the physician, the urologist, has sent over the patients, and we treat them there. And after about a good series of about 15 to 20 treatments, they start seeing a difference. Decreased bleeding, decreased clots. They're able to... not as much pain, and it helps get rid of those symptoms because we're increasing that blood flow to that area that was killed off by that radiation. Okay. And then it helps heal that ulceration that's inside the bladder.
Okay. What do you think, JD? Time to get out of here? It's the bottom of the hour, time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
This winter and shop the largest auto mall in Northeast Ohio with one click at KempThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, there's something for every price range. And KempThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? Never a problem. And we have a huge selection of pre-owns. Kempthorne is a name you know and trust. They've been committed to our community for over 80 years. Shop KempThorne.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today on the program, we're talking about wound care and treatment with Kim Landsberger, registered nurse and program director of the Mercy Wound and Hyperbaric Center. There's a lot more to cover this morning, so let's get back to the show.
We've been talking a little bit about the healing process, and you gave us some ideas of how different treating protocols can help different patients with different wounds. Can you touch momentarily on poor circulation? I know patients, especially with diabetes, often have poor circulation in their hands or their feet, and how does that affect the healing process if you have a foot wound?
So, circulation is the most important thing that we need in order to heal any wound. So we have, in our treatment plan, we have a vascular evaluation that we like to do. And what we do is we evaluate how well the circulation is. Just so during the clinical exam performed by the physicians, they're checking the pulses. We're looking for any abnormalities in the skin, discoloration, even decreased hair growth also shows a sign of decreased circulation. If they see anything of that nature, they will order further studies like some arterial Dopplers or venous Dopplers to actually look at the meticulous side of how our blood flow is. And if there is any type of blockage or reflux in the veins, we will actually refer to our outlying physicians, which is our medical director, for our vascular surgeons. So they'll basically take a large role in improving that blood flow for us, and bring those patients back then after those procedures are done, and then we can heal out those wounds.
Because all your hyperbaric oxygen treatments in the world aren't going to fix it if they just don't have good blood flow.
Right. I can't do anything without it. So that's where that most important thing is that circulation.
We talked about some of this. Are there other conditions besides diabetes and whatever that cause poor circulation? And I suppose anything from tumors to whatever, huh?
Yeah, swelling, lower extremity swelling, the acute peripheral ischemia, those arterial blockages that you might throw a blood clot, and that also in the arteries totally stops that blood flow down to your feet or even in your arms. Most predominantly is in the lower extremity area. Smoking, I can't say enough that smoking is the worst thing that decreases that circulation, and the best thing they could do is the minute they stop smoking, they've already increased their chances.
I'm told the minute they stop smoking, their lungs begin to heal, and then 24 hours, that sort of thing. It just amazes me the number of people still smoke. I don't get it at all. I mean, I've picked up more cigarette butts in parking lots since I was 14 years old. I probably could fill a dump truck with them.
You probably could right now, yeah.
I mean, it just slays me how much smoking still goes on.
Yeah, it's a very important thing that we get rid of smoking. If that would be the biggest saver out of all of this.
Of healthcare dollars.
Yes.
Yeah.
All right, we talked a lot about healing your existing wound, and I'm supposed to ask you now about advanced tissue application. Is that like, Star Wars or Dr. Spock, where they
Yes,
you
that's
zap
very
us
much
and
no.
you make us fancy skin?
So advanced tissue application is used when the wound healing process is kind of stalled out. So we need a little help with that final closure. We have that good granulation tissue, but everything we're doing just isn't enough. So what we do is we apply for these advanced tissues that are donated from either humans, or we get from bovine, or it's artificially processed in a lab. And it could be when it's human donated tissue, could be either skin or fetal membrane. But again, it's all donated, approved tissue and sterilized and goes through a very rigorous process.
If it's okay, is it tissue donated is it live tissue? Is it right after the death of the person or the animal or the?
It can be both, actually. For the human, it could be a person who is a donor. Okay. After death, or it could be actually a live donor as well, that they actually volunteer their tissue, whether it's the fetal tissue, the placental tissue, or the skin. You can actually be a live donor as well, and then the companies take this and break it down, take away all the DNA out of it, and from the other human, and keep the growth factors within those cells, and then make a little sheet out of it, a little piece of tissue, whether it's frozen or it's dried, and then we take that and start the process and apply it to the wound bed, and it helps invigorate the patient's cells to grow new growth and skin and heal a lot faster. When it would take me months, it would take me weeks.
Okay, but it has to basically be fresh tissue. It can't be dead tissue I remember when my sister died, she had signed up to have certain parts donated, and they took her corneas and all that sort of thing. Well, when I went into the emergency room, she was already gone, and it hadn't been more than, 2 or 3 hours. So you must have to get that material quickly.
They have a process, that they take care of all that, but most of ours is live.
Okay.
Live tissue.
So let me go a little bit off the chart here and ask you a question. There's a lot of people that even though they don't have open sores on their feet, they may have corns, calluses, bunions, which maybe I don't know exactly what they are. What about the hyperbaric? Is there any problem, or is there a reason to use hyperbaric on those conditions or not?
No, so those are areas where you have like wrong fitting shoes or pressure points that aren't being addressed appropriately, and you just you're not educated as to where the right shoes come in. So that's where a podiatrist would come in and have them evaluate your foot to see if there's any other deformities, or if there's those corns and calluses. They actually have treatment plans within their centers and to treat those areas so they don't become ulcerations.
Okay.
What about, I guess I'm trying to think in the respect of, what do you do to help the patient support them psychologically? I mean, I would think that at some point, did the patients get desperate when they've had a wound for weeks and weeks, and they're looking at it every day?
Every day.
Concerned? I mean, I guess we haven't really talked about, oh my gosh, I've got this sore in my foot, and my neighbors told me that if it doesn't heal, they're going to amputate, or you know how stories spread. So,
yes.
How do you help a patient deal with those really scary things?
So the fact that we have them come in on a weekly basis, we closely monitor not only the wound but our patients. We talk to them. I mean, just the fact that we ask them how they're doing, making sure they have everything they need, and providing that little bit of support of saying, hello, we are here for you. We tell us what's going on and what can we do to help. Sometimes just that simple amount of talking on that weekly basis that we provide for them lets them know that it is important that we see them and that they can heal, and they get that little bit of that social discussion going on, and they start feeling a little bit better, like, you know what, I do need to heal this wound, and I can do this. So we're always there talking to them, and especially if they go in hyperbarics, my HBO tech becomes their new best friend every day, and he jokes with them and has a great time with them, and we become really close with our patients.
I've been dying to ask this. Do they get to watch HBO in the HBO?
Only if our hospital provides HBO.
Okay. All right, I'm sorry. Bad joke. So.
High def. I have high def. I at least have that. I have Blu-ray and everything.
That's all we need, okay.
Yes.
In the hotel room I was just in, they had this enormous TV, and it was all high definition. My gosh, you can see a little tiny scratch on the woman's face.
Yes.
Holy cow, I don't happen
We
to
can
have.
move the TVs closer if they need it.
Nice. Okay. All right.
How about safety? You have to have a certain protocol for what a person can wear or have on their body in the hyperbaric chamber, correct?
Yes, so we have a very rigorous checklist that we provide all our patients, that we go through education prior to them going into our chambers. So we basically tell them everything that you wear into the hospital to come into our center has to come off, except for, of course, the dressings. We actually have been tested and approved to go in the chambers. We provide gowns and hospital-approved blankets and sheets so we can cover them up if they get cold. And then we also make sure that they have no lotions, no deodorants, anything that has any type of metal, petroleum-based products, so it doesn't cause fire or anything of that nature. So, and then health-wise, we also look at chest x-rays to make sure there's nothing going on in their lungs and that their heart is healthy enough to tolerate the pressure.
Now, it's not a mask.
No.
It's the entire chamber.
You sit in a tube.
Okay.
You sit or lay down in a tube, basically, for 2 hours.
Okay.
Yes. Because it doesn't work. You can't just lay we lay oxygen on us right now. It's 21% oxygen, but you go into this tube and you are in 100% oxygen, breathing it in the entire time. Okay. That's how oxygen works. You have to breathe it in for it to work.
And I can move my arms and move my legs.
You can flip around, change positions. Our chambers are so large you can almost sit up in them.
Okay. All right.
Refresh my memory. How much pressure are you dealing with?
So the pressurization, all depending on the diagnosis again, you can go anywhere from 33 feet to 45 feet to even 66 feet below sea level. And all depending on the diagnosis and how many treatments you need. Sometimes you only need one treatment, like, for example, the carbon monoxide treatment. Hyperbaric oxygen therapy does treat carbon monoxide or assist with it because you breathed in all this gas and everything like that, and it replaced the oxygen within your body. You may only need one or two treatments to help with that area, but you would be in there for an extended period of time. Now, would I treat carbon monoxide? Yes. But again, we are an outpatient center, so we would have to, if it occurred at night, unfortunately, the hospital would be required to send you to another facility for those treatments. But if it was during the day and I had, and they needed that help, we would be there to help them.
Anybody ever come out of that machine with a bends?
No, because I treat the bends.
I was just thinking about my scuba diving history, so I was trying to remember the depths. And
so we base all our depths off of the Navy dive tables back in the old days when they tested the Navy sailors and everything. That's how we got our dive tables from.
Neat.
Okay, gang, final break is here. Listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, this is Brad White from the Medicine Center Pharmacy. Do you feel stressed and tired? Do you rely on caffeine, crave salty snacks, have mid-afternoon lows, and can't bounce back? These may be signs of adrenal fatigue. The Medicine Center Pharmacy offers easy saliva cortisol testing and nutritional supplements to help you get your energy back. Talk to your Medicine Center pharmacist and see if cortisol testing is right for you. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
That's right. This is Paul White, and the Half Off on Hot Buy store is your cold weather source. Women's Winter Tech gear boots are only $6.95. Fashion boots are marked down to $9.99. Retail value up to $60. And hats and gloves are on sale, too. New in the store are American greeting cards. 2 for 99 cents. Regular price at $4 each. Also, for snow shovels to floor mats, stop in the Half Off on Hot Buy store. Find the best deals in town.
Hi, this is JP, and I'm here with my grandpa talking about the amazing deals at the Half Off and Hot Buy store in Louisville. Visit our website at halfoffhotbuys.com and check us out on Facebook, too.
Hi, Paul White for the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. We are back, and you're listening to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White, and we're glad. And we're talking today about wound care and treatment. So let's get back to the rest of the show.
How about insurance?
We pretty much take everything. Mercy Medical Center takes a wide range of pretty much all insurances in the area, and hyperbaric oxygen therapy is usually covered by almost all insurance. We go through a rigorous process to make sure that they are covered and that we can help maintain their coverage and their care.
Very good. What about the medications? Can certain medications hurt the healing process?
Yeah, there's a lot of medications that can halt the wound healing. One of them is steroids. They tend... You know how they blow you up and make you all swollen and everything like that? They can also impede on wound healing. They decrease that area. Also, hormone therapies. Some can also halt your healing as well.
How about speak to over-the-counter meds? Okay. Anything in the over-the-counter arena that might impede the aspirin, decongestants,
aspirin we actually write, some doctors recommend the aspirin to help increase with the blood flow and prevent any clots, but I'm not aware of myself.
Okay. I was listening to somebody talk quite a few days ago, and she was taking aspirin and had surgery, and they couldn't stop the bleeding.
Right, because it increases that blood flow.
Sure.
Yeah, so it makes it harder for us to stop that flow when you have it thinned out like that. So that's why we have some people, for certain procedures, medically stop their aspirin or any of their antiplatelet medications too.
What about edema? I mean, I've heard people came in the store, well, I just gained 20 pounds because of fluid retention, and they had to give me tons of Lasix to, drain it. Any issue there? I mean,
so the fluid buildup does, in the edema to the lower extremities, does affect our healing. So absolutely, we consider the big swollen fluid-filled leg as a big pool that would be like infection, erupting and affecting those cells around that leg. This is where we look at comprehensive management with compression therapy if their legs are able to tolerate it, and we actually will wrap their legs with the adequate type of compression to push that fluid back up into their system and get rid of it. Okay. And that helps increase the flow.
Can you speak to autoimmune diseases? Are they linked to wounds that won't heal?
Yeah, so there's some diseases out there that doesn't, like rheumatoid arthritis, ulcerative colitis, Crohn's, even vasculitis are some of those things that are a lot harder to treat if those are one of those comorbidities out there. We've had a difficult time with them. Can we do it? Yes, but it just takes a little bit longer.
Okay, everybody in the world's taking nutritional supplements of all kinds, from testosterone. I mean, listen to the cable TV or the radio. Take this. What about that stuff?
So we always recommend, vitamin C every day. Other healing agents is copper, zinc. But I always say go back to basics. Look in your garden and look at, your proteins. You want to eat your fish, your chicken, your turkey. It's going back to those fresh fruits and vegetables that have those healing and antioxidants within the foods as well. But you can take nutritional supplements, but I honestly recommend going back to the natural way of doing things.
Whole food type stuff?
Whole foods, yes.
Okay. What about the physicians associated with the wound center? What are their specialties, areas of interest, scope?
So we have a wide range of specialties now. We've just recently expanded. We now have 10 physicians in all, so we have coverage to see patients 5 days a week. I have one vascular surgeon, which is my medical director. I have one general surgeon. I have one plastic surgeon, 3 podiatrists, and 4 internists. So I have quite a variety, and we all work together. If we can't figure something out, we'll talk to each other. We have meetings, and we try to figure those difficult cases out.
Okay, very interesting.
Any research projects you guys are working on at the moment? Just out of curiosity. I mean, it seems like there's always cutting-edge things going on at Mercy.
There is always research going on. I'm not currently in any certain research projects right now, but I'll research anything and heal them out as best I can. And if I can't figure it out, I'll make sure I get somewhere where I can. I have a wide variety of support that I can reach out to others and find out how to heal those difficult cases. And if I can't find it or have it, I will make sure I can find a way to get it.
I think I told you this last time you were on the program, that we have a wide variety of wound care products in our can store. Okay. If it is made, I think we might have it. And the reason we have it is because we purchase drugstores through a broker that go out of business, and we get all these stuff from around the country that we normally wouldn't order. And, I've learned a lot about some of the things we have and things I didn't know anything about, in the past. So we are exposed to those kind of products. I would suggest you, if you need something that's a little on the pricey side, you may want to check with us.
We'd be happy to do
We
that.
don't want to warehouse it, okay?
I don't blame you.
We just want to sell it.
We use a wide variety of different types of products and stuff like that. And we always have patients that have a difficult time finding those products. And we always need a good referral source to make sure we can get those.
It's amazing
provided.
how much wound care products have changed just in the last 5 or 10 years.
We have anywhere from calcium, our advanced therapies of calcium alginate impregnated with silver to help fight infection.
So a lot of it.
We actually use something like a honey-based product, and then we have your basic, and then we have paper collagen that's produced in a lab that helps those growth cells as well, that you can buy, with a prescription, of course, and with those compression therapy and stuff like that. So yeah, it's pretty extensive on the different types of things that you can use to keep those wounds to heal.
Well, we're kind of out of time, unfortunately. We probably could use a little bit more time, but thank you to our guest today, Kim Landsberger, registered nurse and director of Mercy Wound and Hyperbaric Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and Kempthorne Motors, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Join us next week when Anna Frum of Altman's Lipidemia Management Clinic talks with us about lymphedema.
Lymphedema.
Hey, big word. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.